Last week was historic for the White House and the country, not just in the Supreme Court ruling on the health care law. Later that same day, Attorney General Eric Holder became the first sitting cabinet member in history to be held in contempt of Congress. So what impact will these twin controversies have on the presidential race? Joining us now is Julie Ruginski. She's a Fox News contributor and former communications director for the former New Jersey Senator John Corzine. And Deneen Borelli is a Fox News contributor and author of the book Backlash. Welcome to you both. Deneen, let me start with you. You just heard Pam Bondi basically explain the Republican position, calling the health care plan junk, a huge tax increase. How do the Republicans get traction in their vow to try to repeal it?
Well, that's just it. There is traction here because what we have is a classic example of government gone wild. And you know what, Eric? The American people are sick and tired of it. We have a Supreme Court justice who basically is playing politics, really. This is clearly a tax on the American people. The last thing you want to do is implement more taxes on hardworking Americans. And so clearly, I think there is a lot of traction here to repeal this initiative because it's not popular with the American people. It is a tax. It wasn't sold as a tax, and that is what we're facing today.
Julie, in your view, is it a tax, and how do you think that will impact the president?
Well, in Justice Roberts' view, it's a tax. Just because the Supreme Court justice says it's a tax doesn't mean it's a tax. Look, I looked at it as something that the Commerce Clause should have been applied to. I look at it as something that's widely popular. Some of its provisions, we want to talk about the individual mandate, but people are about to have health care access that does not deny them health care, even if they have pre-existing conditions. If they have rescission, which means if I get cancer, my insurance company can't throw me off the rolls. If I have a child, he can stay on my health care till I'm 26 years old. All of those provisions are extraordinarily popular with the American public. When Mitt Romney talks about full repeal, he's talking about repealing not just the individual mandate, he's talking about repealing all those very popular components of the health care reform. And I think that's a huge mistake politically for him to do, and I think that's something that's going to come back and bite him come November.
Deneen, is that a mistake?
Listen, listen to the will of the American people. I was just in Ohio at We the People convention, and when this ruling came out, this just reinvigorated these individuals and reignited them to fight for liberty and to hold our politicians accountable. This is not a popular mandate. Americans are outraged at the fact that we are being taxed even more, and look at the Medicaid example with this, with the ruling as well. More and more Americans are going to be added to the Medicaid rolls where we're already facing fraud, waste, and abuse. How come that has not been addressed? So clearly, it's not popular with the overwhelming majority of Americans. The states aren't happy about this because they can't afford it either. Our country is broke, and so I think this is a very bad policy to be forcing on Americans. And it's a tax. Over 16,000 new IRS agents will be hired to go after individuals with this. Are you kidding me? Americans are not happy about this.
You know, with all due respect, expanding Medicaid is for people that can't afford health care. So rather than you and I paying for them to go to the emergency room and coming out of our tax dollars where we have to supplement these emergency rooms because these people can't afford health care, they'll now be able to have health care. As far as I'm concerned, this is a humane policy. It's a policy that's good for the American people, for those that don't have health care. And if you want to deny them, you want to deny people Medicaid because they can't afford any other health care and forcing them to go to emergency room for treatment, that's cruel. That's bad for their health care, and it's bad for our pocketbooks because the average American family pays $2,200 per family in fees to cover people who are uninsured because they go to emergency rooms. That's a tax on me, Deneen. It's a tax on you. It's not acceptable. We need to do something about it, and this health care plan does.
Julie and Deneen, last point, just 30 seconds. Eric Holder held in contempt of court. I mean, that's not good, Julie.
That's not good for Eric Holder. I think it's not good for the way Congress is seen either. It's a partisan ploy by Darrell Issa. We have, vast issues that we could be talking about, but instead he doesn't want to cooperate with Eric Holder. He doesn't want to cooperate with the White House. He'd rather play politics. That's fine. It gets him on the Sunday talk shows. He's very happy. He tweeted last week that he's doing the full Ginsburg, quote unquote, to get on the talk shows. That's great. It ups his profile. But the bottom line is we have a tragic death of a federal agent. We have a policy that really needs to be gotten to the bottom of, and instead Darrell Issa would rather play politics and grandstand than actually get to the bottom of it, and that's tragic.
Deneen, is it grandstanding? I said contempt of court, I meant contempt of Congress.
Yeah, what we need is to get to the bottom of this. My heart goes out to Brian Terry's family. We still don't have anyone that is held accountable for what happened. And Eric Holder is a disgrace, I think, by defying Congress. All he had to do was turn over all of the documents, not some, not a few, not the ones that he select, but all of the documents so that we can get to the bottom of it. But clearly, he is not doing his basic duty in upholding the highest one of the big positions in our country by obeying the law. He should have done so in the very beginning. We wouldn't even be going through all of this nonsense.
All right, that'll have to be the last word for now. Deneen and Julie, thanks so much. We have a preview of what we're going to have the next 4 months until Election Day. Thanks again.
Thank you.
Thanks very much.